Assalamu alaikum. Hello everybody. Today our video is about sonographic cobblestone appearance seen in cellulitis. We will begin with introduction, then we will talk about normal soft tissue ultrasound findings, then cellulitis. Introduction. Many patients come to the emergency department with complaints related to the soft tissues, such as infection, injury, and abnormal masses. Traditionally, computed tomography and magnetic resonance have been used when imaging studies are needed in these patients. However, ultrasound is generally more readily available and in some instances is the preferred imaging study. The most common use of ultrasound in patients with soft tissue abnormalities is in the evaluation of infections, including cellulitis, abscess, and necrotizing fasciitis. Other soft tissue indications include the evaluation of cysts and lymph nodes. Ultrasound is also used to locate foreign bodies. Normal soft tissue ultrasound findings. By ultrasonography, the epidermis and dermis can't be differentiated. They appear together as a thin hyperechoic layer. The subcutaneous layer appears hypoechoic on ultrasound, with two components, hypoechoic fat interspersed with hyperechoic linear echoes, running mostly parallel to the skin, which represent connective tissue septa. Veins and nerves can be visualized within the subcutaneous layer. Fascia appears as a linear hyperechoic layer. Its thickness will vary depending on location. Muscle fascicles can be visualized as hypoechoic cylindrical structures with hyperechoic connective tissue surrounding them. A characteristic feature of muscle is that its appearance on ultrasound changes with contraction. When contracted, it appears thicker and more echoic on short-axis planes. Then we'll talk about cellulitis. Cellulitis is a pathologic condition very frequently encountered during soft tissue ultrasonography. The ultrasound appearance of cellulitis varies depending on its stage and severity. The initial appearance may be generalized swelling and increased echogenicity of the skin and subcutaneous tissues. This ultrasound image shows early cellulitis on the left compared with normal soft tissue on the right. As the cellulitis progresses and the amount of subcutaneous fluid increases, hyperechoic fat lobules become separated by hypoechoic or anechoic fluid-filled areas. This later stage of cellulitis is most typical and has been described as having cobblestone appearance. The appearance of fluid-filled interlobar septi is not specific for cellulitis, but rather is indicative of generalized subcutaneous edema, which can result from conditions such as congestive heart failure. Color and power Doppler are advanced ultrasound modalities that can help determine whether the inflammation characteristic of cellulitis is present. However, their use in the emergency department is beyond the skills of some emergency practitioners, who will instead rely on the physical examination for clinical correlation.